Recording?
I am.
Woohoo! Awesome. Well, welcome everybody. You know, we like to start our webinars and seminars on time. I wanted to welcome you all here to the LT Senior Services webinar. And today our topic is going to be Medicare and the coronavirus. It's going to be an excellent webinar. We're so happy to have Scott Gidley here. Before we get started, what I'd like to do is just talk a little bit about the technology, give you some technology hints. So if you are on your computer, if you go up, kind of take your mouse up towards the top and then drag it over, you're going to see where there's a speaker view. Right now I have speaker view on. I'm going to click that and change it to gallery view. When you change it to gallery view, what you'll see is the person who's speaking will be in the big picture and the people who are not talking will be kind of around it. I'm using real technical terms there. But if you want to keep it in the gallery view, then you'll see everybody's little boxes. Not everybody is logged on with the video. I totally understand why you wouldn't want to do that. It takes a lot of effort. I had to put on lipstick, do my hair. So it's totally fine that you're not there in video mode. But I wanted to let you know that. If you are on an iPad, let me tell you how it looks on an iPad. So you go up across the top. And let's see, I really don't know how to do it. Oh, you go up across the top, and then on the left-hand side, you can change. You can switch to gallery, or you can switch to speaker. So people just have a particular preference, however they would like it, and that's totally fine. And then some other hints, as you scroll down with your mouse towards the bottom, you're going to see on the left-hand side, mute. This is where you can mute and unmute yourself. Next to it, you have stop video, but you see that little arrow going up? This is where you can choose your virtual background. So we had some fun with our Zoom happy hour on Friday where people were changing their virtual background. That's how you can change your virtual background. As you go across, you're going to see an area where it says chat. And that's a place in which we can put chat information. This is where you can put questions for Scott. If you're on mute, if you are not on mute and you want to ask questions, feel free. There'll be times that he'll be asking for input, so we'll look for your input there. But this is another place that you can just pop on the chat and then you could just ask any questions that you'd like. And then we also have a little area where there's reactions. So if you just click on reactions, for example, I'm going to say thumbs up. Now, if you look across the bottom and you're not seeing these features, it could be that you have an older version of Zoom. What I found out that even though it's an online software package, that there are different versions. And so you might just need to get a newer version of Zoom. But woohoo, Pam, look at you. Got her reaction on there. Awesome. So I'm going to pull up the chat. Right now we have Natalie. Hey, Natalie. She's going to be our driver and let everybody in. So we have a chat area here. So again, if you have a question at any time, if you want to pop in your question here, I'll be looking and Natalie will be looking and we will ask Scott. So again, this is our new webinar series with LT Senior Services. We are a nonprofit out of the Lake Travis area, and our whole purpose is to serve as a resource to serve and engage aging adults and their families in the community. So we have invited all seniors across the city, though, to join in our webinars. So if you live in another geographic area, you likely have attended one of our other events in a library, at an Aging Well conference, or some other time. But since it's on the internet, you don't have to drive over here, so we thought we'll just invite everybody to it. We're also going to be recording and uploading these talks to a YouTube channel. This is all coming. We've had to kind of scramble to get to this point. So we're excited to be able to offer that in the near future. So be looking for that too. We have a directory, which we used to give out when we had events. And in this directory, you're going to find about 45 different nonprofits and businesses who've come together to help. So we'd love to get this out to you. If you want to put in the chat to send you one via mail, we'll do that for you. We hope to be handing these out in the near future. I don't know if it will be in May, but right now we're going to keep our May date for our event. Our partners for our Lake Travis Senior Services have been the library. We love the library. They have been awesome to us. They help us promote our events to their people who belong to the library, and we hold our events at the library. We've also added an evening event at the Lakeway Activity Center. So we're excited about that new relationship with the Lakeway Activity Center. And those talks will be different than the talks that we do at the library. And they're going to be geared uh, maybe more towards the, what do I say, the adult child, and information like that for the adult child. So we're super excited about that seminar series. It was supposed to begin in April. It's not, obviously, but we are bringing those talks online. Man, I feel like I've talked so much already. So our agenda today is we're going to be talking about Medicare and the coronavirus. And let me just tell you a little bit about Scott. He is the founder and president of Charitable Financial Partners, and he is a long-term resident of Lakeway. He's actively supported the community by serving on boards and task force committees, by fundraising for scholarships, teacher grants, and LTIC organizations and youth sports, and by volunteering with several local nonprofits, and by coaching, refereeing, and umpiring. How do you say that?
Umpiring.
LTYA Sports. He and his wife, she's a banker with Independent Bank in Lakeway. They have 2 daughters who attended and graduated from LTHS, and they're both now teachers at LTISD. Oh my goodness, we could have a whole webinar about how their life has changed, huh? He enjoys the diverse lifestyle opportunities of our Lakeway and Lake Travis communities, and he enjoys walking his grand dogs in our beautiful parks. With over 30 years of experience in financial services, Scott is the founder and president of Charitable Financial Partners, a local financial firm that provides objective and independent Medicare insurance planning advice, as well as comprehensive wealth management services. Annually, Scott supports several local charitable organizations. And Scott was to be our speaker in October. He still will. And he'll be bringing to us information about the changes in Medicare for the next year. So we appreciate, he has been a very valued speaker in the past. And he had this great idea for this webinar. And we thought, oh my gosh, we need to learn about this. So that's why he's here today. So Scott, I'm going to let you take over. And I'm going to put you in speaker view on mine. So there you go, sir. Let us know what you know.
Thank you, Cindy. After hearing that introduction, I feel like I need to condense that a little bit. It's kind of long-winded. I thank you for this opportunity. And yes, I am a seasoned financial advisor. I am Medicare eligible, so I do have some working knowledge with this. And I am certified in Medicare insurance planning. So by way of disclosure, my presentation today needed to be and has been filed with CMS, which is the Centers of Medicare and Medicaid Services, and it's been filed with them as a formal educational event. So I need to maintain the status being educational, and I can't really delve into talking about Medicare products and how they work. So I need to keep this educational. I'll give a 5 to 10 minute presentation, and I'm sorry, and Natalie will coach me in the future on how to download and print screens, but it'll just be verbal today because I'm still a novice at Zoom. So please bear with me and forgive me and don't judge me. You know, even though I'm in desperate need of a haircut because I'm quarantined with this coronavirus, I'll still try to share some facts and ideas with you about how Medicare is trying to help with this pandemic. So first of all, know that Medicare wants to protect you. Your health and your safety and your welfare are their highest priorities. And according to CDC, which is the Centers for Disease Control and Prevention, older folks and people who have severe medical conditions like heart and lung or kidney disease may be at a higher risk for more serious COVID-19 illness. So unfortunately, this means that a lot of people with Medicare are at higher risk. What can we do to try to manage this situation intelligently, effectively, and compassionately? Some of my presentation I'm about to give may be old news to you, but nevertheless, I'm going to summarize the following guidelines posted on Medicare.gov. First of all, they suggest that we follow the coronavirus guidelines. And here's some important ways to do your part. Follow the directions of your state and local authorities. Keep your entire household at home if someone in your household has been tested positive for the coronavirus. If you are an older person, or you have a serious underlying health condition that can put you at increased risk, such as impaired lung or heart functions or a weakened immune system, stay home and stay away from other people. We all need to do our part to try to slow the spread of coronavirus. Here's how we can help. Avoid social gatherings in groups of more than 5 people. Avoid close contact, 6 feet or so is the measurement, with people who are sick. If you're working or you're engaged in schooling from home, try to do it from home whenever possible as opposed to going outside. Avoid eating or drinking at bars, restaurants, food courts. Use drive-throughs, pickup, or delivery options. And certainly try to avoid discretionary travel, shopping trips, and social visits. Now, there are also some hygiene precautions that you can take. Wash your hands often with soap and water for at least 20 seconds, especially after being out in public, blowing your nose, coughing, or sneezing. If soap and water are not available, use a hand sanitizer that contains at least a 60% alcohol percentage. Avoid contact with high-touch surfaces like elevator buttons, if you're out, but you shouldn't be, door handles, handrails, grocery cart handles, paper money, shared pens, touch screens, kitchen sponges, soap dispensers, airport objects, as well as the handling of pets and shaking hands with people. Use a tissue or your sleeve to cover your hand or finger if you must touch something. And try to avoid touching your face, nose, and eyes. Clean and disinfect frequently touch surfaces in your home, such as tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, cell phones, etc. Also be smart about preparing for your healthcare needs. Be sure you have plenty of over-the-counter medicines and medical supplies, like tissues, to treat fever and other symptoms. Most people will be able to recover from COVID-19 at home. Have enough household items and groceries on hand so that you will be prepared to stay at home for a while. Now, we need to recognize that what we're going through right now with this pandemic is stressful. So how should we cope with this stress? Certainly, older people are at a higher risk for severe illness from COVID-19, which may result in increased stress during this crisis. Here are a few things you can do to manage this stress. Take deep breaths. Take breaks from watching, reading, or listening to news and social media. Hearing about the pandemic repeatedly certainly can be upsetting. Make time to unwind. Try to do something that is enjoyable to you. Take care of your body. Take deep breaths, like I said, stretch, meditate, practice yoga, eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, and try to avoid excessive alcohol consumption, and certainly try to avoid drug consumption. Connect with others. Talk with people you trust about your concerns and how you're feeling. Call your healthcare provider if stress gets in the way of your daily activities for several days in a row. If you or someone you care about are overwhelmed with emotions like sadness or depression or anxiety, or you feel like you want to harm yourself or others, please call 911 or please call the Mental Health Services Administration's Disaster Distress Helpline at 1-800-985-5990. So with that background, let's talk about, what does Medicare cover? Medicare Part B will cover the lab tests for COVID-19 when it is ordered by your doctor. And in that case, you pay no out-of-pocket costs. Now, the critical thing there is Medicare is saying that treatment for Medicare, in order to be covered by Medicare, needs to be authorized by your medical provider. You can't just willy-nilly go out and say, I'm going to go here and I'm going to do a COVID-19 exam. Probably won't be covered by Medicare. You do need to contact your provider and you do need to have that authorized. Medicare Part A covers medically necessary hospitalizations, again, if ordered by a doctor and if the hospital you go to accepts Medicare. This does include if you're diagnosed with COVID-19 and otherwise might have been discharged from the hospital after an inpatient stay but instead you need to stay in the hospital under quarantine. We all know that to date, there is no vaccine for COVID-19 yet. If one becomes available, it will be covered by Medicare prescription drug plans, your Part D plans, and also with your prescription drug coverage under your Part C Medicare Advantage plans. If you do have a Medicare Advantage plan, which is known as a Part C plan, you do have access to all these same benefits that original Medicare offers. Medicare allows these plans to waive cost-sharing expenses for COVID lab tests. Cost-sharing expenses are such things like co-pays, deductibles, co-insurance. Many plans will offer additional telehealth benefits beyond the standard scope of coverage. So you need to check with your plan about your coverage and the respective costs. Now, I think someone else is going to talk subsequently about scams, but know that there are a lot of scammers using this coronavirus emergency to take advantage of people while they're distracted. Guard your Medicare card like a credit card. Check your Medicare claims summary forms for errors. And if someone calls you asking for your Medicare number, or if they're trying to offer vaccines or tests or masks or medical equipment related to COVID-19, just hang up. It's not ethical, it's not real, it's not right, and they're trying to scam you. I talked a little bit about telehealth and related services. Medicare Part B already covers certain telehealth services and has now temporarily broadened its coverage of telehealth services to respond to COVID-19. Current telehealth covered services will be expanded to help you have access from more places, like your home, with a wider range of communication tools like pads, tablets, smartphones, and to interact with a range of providers, your doctors, your nurse practitioners, clinical psychologists, and licensed clinical social workers. You'll be able to receive services through telehealth, including evaluation and common office visits, mental health counseling, and preventive health screenings. Coinsurance and deductibles and copays may apply, but most healthcare providers currently are reducing or waiving these fees in this current situation. With Medicare Advantage plans, you'll have no out-of-pocket costs for telehealth services for coronavirus. You will be able to visit your doctor from your home without having to go to a doctor's office or hospital, which puts you and others at risk of exposure of COVID-19, obviously. You'll be able to communicate with your doctors or certain other practitioners without going to the doctor's office in person for a full visit. Medicare B also pays for virtual check-ins, which are brief virtual services with your physician or certain practitioners where the communication is not related to a medical visit within the previous 7 days or does not lead to a medical visit within the next 24 hours. You will need to consent verbally to using virtual check-ins, and your doctor must document that consent in your medical record before you can use this service. You may have to pay your usual Medicare copay, coinsurance, and deductible for these services, but they may also be waived, and there have been announcements by CDC and by most insurance providers that they will be waiving these fees in this current pandemic. Medicare B also pays for you to communicate with your doctors using online patient portals without going to the doctor's office. So like the virtual check-ins, you must initiate these communications. If you live in a rural area, you may use communication technology to have full visits with your doctors. However, the law does require that these visits take place at specified sites of service known as telehealth originating sites. Now, what are some of the other ways that Medicare is helping? Medicare is responsible for developing and enforcing the health and safety requirements that healthcare providers must meet because the consumer expects a certain standard of care, including taking these additional steps in response to the coronavirus. Taking action and exercising regulatory flexibility to help healthcare providers and Medicare health plans is something that Medicare is going to do. Addressing the need to increase capacity to care for patients Hospitals now can provide hospital services in other healthcare sites that are not currently considered part of a healthcare facility. And this does include off-site screenings. Medicare is waiving certain benefit requirements for skilled nursing facility care covered by Part A. In other words, you don't have to have a certain waiting period or a certain period in which to qualify for it. They're also establishing new codes to allow providers to correctly bill for services related to the diagnosis and treatment of this illness. They are instructing the national network of state survey agencies and accrediting organizations to focus their efforts on infection prevention and abuse, as well as neglect in nursing homes and hospitals. They are instructing nursing homes and hospitals to review their infection control procedures, which they're required to maintain at all times. They are issuing important guidance and answering questions that nursing homes may have with respect to addressing cases of COVID-19. All that being said, how can you stay current? Well, every day we read more and more in the paper, we hear more and more on TV, we have more and more on the internet telling us about what's going on and what we need to do. Listen to good news. The coronavirus.gov is one site, and it's the source of the latest information about COVID-19 prevention, symptoms, and answers to common questions. You can also go online and look at cdc.gov. They have the latest public health and safety information from CDC, as well as for the medical and health provider community about COVID-19. USA.gov has the latest information about what the US government is doing in response to COVID-19. Medicare.gov has the latest information about what Medicare is doing to help consumers manage COVID-19. And whitehouse.gov has the latest information about what the president's current guidelines are. So check these sources often, because rules, regulations, procedures, information, recommendations are all evolving regularly, almost daily, almost hourly. So now that I've satisfied this educational event compliance, let's make this more interactive, Cindy and Natalie. What questions might you have, and what can I try to answer? And if I don't know the answer, certainly I will find out and get back to you.
So Natalie's going to unmute everybody, and then if you want to speak, you still will have to unmute yourself. So the way that you unmute yourself, let me see if I can figure this out. You'll go up to the top right corner, I believe, and it says mute or unmute. So that's how you'll unmute yourself. But we as an organization will unmute you so you can ask a question. Let me ask the first question, Scott, and that is, should we go ahead and set up the telemedical now, anticipating that we might need it in the future, and just have that already? What's your feeling on that?
Yes, and your doctors should be proactive on this. I know that I do some work with the WellMed clinic that's here in Lakeway, and they have already started their communication about, here's how you can set up telehealth, and here's how you can set up this service, and be ready and be prepared, and proact, don't react. So yes, your healthcare providers should be able to help you with setting up the telehealth services.
Okay, great. Everybody just kind of ask your question, or Natalie, what were you going to say?
I was just going to say, if you have a question but you don't feel comfortable speaking, you can type it in the chat, which you can find at the bottom of the screen. You just click on chat and type in your question, and then I can go ahead and ask Scott on your behalf.
Excellent, thank you. And guys, just go ahead and we won't do a round robin. Oftentimes we'll go around and ask each person if they have a question. But if you have a question, go ahead and ask. If you don't, I have some more. I'll just keep on asking. Scott, can you change who you are currently getting your services through based on the new virus, I guess? Is there, I know you have open enrollment. When's open enrollment? And is this a time that you could also change?
Well, typically your open enrollment is October 15th through December 7th, and that is your annual enrollment period. However, There's also January 1st to March 31st if you have Medicare Advantage plans. And if you have a Medicare supplement, a Medigap plan like a Plan F or Plan G, you can change anytime during the course of the year with a Medicare supplement plan. There are certain group plans out there that are allowing a special enrollment period now based on this coronavirus complication. But in terms of changing your Medicare Advantage, no, you have to wait until that open enrollment in October. If you have a Medicare supplement plan, you can change it anytime.
Okay, great.
And it's always important to know that if you're doing this research, make sure that the doctor that you are changing to does accept Medicare and does accept your the program that you have. And it's also a good time to take a look at your prescription drug plan too, because the prescriptions you take will change. And the providers annually will change how they tier or how they classify certain drugs. So last year, what may have been a tier 2 or tier 3 that might cost you $10 or $15 or $20 for it, or you might have a tier 3 drug that may subject you to a deductible before you have the copay. Those might change, and what might be a 3 last year might be a 2 this year, might be a 1 the next year. So it's always important annually to look at what prescription drugs you're taking and make sure that the plan that you have is the best for you.
Is there any kind of gotchas right now that you're seeing for people? Is there anything where people are getting taken advantage of, or the costs are just extremely high? Anything like that?
Well, I want to continue the focus here on the coronavirus, and to date, no, other than the scams that are going on. But it is important to talk with each of your plan. I mean, pull out your Medicare card and get your customer service number and call them and make sure that what you're doing is fully covered, and is that company actually reducing or eliminating the co-pays or the co-insurance or the deductibles based on illnesses related to the coronavirus.
I think doing the research before it potentially happens to you or a family member is always the way to go. Don't you agree?
Yes, I do.
Really, yeah.
And there we get the Golden Gate background. I love it.
Yes. Hey, we're in the question answer period right now. So more, if you've got any questions for Scott, that's where we are. Natalie's going to ask a question, I think, for one of the participants.
Yes. Scott, we have a question from the chat. And the question is, does Medicare Home Health Services, if needed for conditions related to the virus or at any other time, is there a waiting period or limit on visits?
That waiting period and limit should be waived based on the coronavirus. But again, talk with your plan provider.
Is the best way to talk to them calling? Or I bet it's probably hard to get a hold of people right now.
Calling is the best way of doing it, yes. You got to call your 800 numbers to, and I'm not trying to be partial, but Cigna, United Healthcare, or Aetna, or Blue Cross Blue Shield, or Mutual of Omaha. I mean, numerous companies. You need to reach out, and there may be a delay, but calling them directly is the best way. You can go on to their website too, and oftentimes they'll have an open chat with a representative. So if you can't get through them on the phone, there is a consumer, a client portal that you can go on, and typically someone will pop up and say, do you want to chat, or is there something to talk about?
One of the things I was surprised when we had another seminar at a library is that mental health is covered under Medicare. Is that under all Medicare plans or just under special?
It should be under all Medicare plans, yeah.
So this particular practitioner comes to the home, does home calls, and actually visits with you, and it's covered under Medicare. So that's, I doubt they're doing that now. But
yeah, the key is it medically necessary, and has it been approved and authorized by a doctor? You just can't initiate on your own. You need to communicate with the provider and get it documented and make sure it's consented in order for Medicare to cover it.
Right. Okay. Great.
So what about telemed? Is that covered now completely?
Yes. We talked about that just a little while ago, but that's something. Telehealth services have been covered historically with certain cost sharing, but now in the light of the coronavirus, they are waiving the cost sharing expenses. So there's not going to be a deductible, no copay, no coinsurance relative to any sort of telehealth services. And right now, from what I read, that's going through, some companies say May 31st and some are saying June 18th. So again, another good reason to contact your particular provider and make sure you understand what their rules and regulations are.
It seems like this could be a new trend, just like doing Zoom calls for our seminars. Now we're doing them online. This could just be a brand new trend that we have a lot more telemedical, don't you think?
I think so, and we boomers just need to accept the fact that we need to be more technologically adept. And I'm still the type where I want to go see my doctor. I want to go in and see him and have him touch me and take my blood pressure and take my temperature and all that kind of stuff. But we're subjecting that doctor and his or her staff to the coronavirus if we have it. So we have to understand, we have to be patient, and I think we need to play our part.
Do we have any other questions for Mr. Gidley? Okay. Well, next.
Then hold on now.
Hold on.
If this is going to be on YouTube.
Yes.
And I'm not auditioning for anything, but I did read something on Facebook just this morning from a friend of mine. And if those of you are fans of Simon and Garfunkel, you'll probably know that they composed a song saying 50 ways to leave your lover. And I read this 50 ways to beat COVID-19. So I apologize if I'm out of tune, but here we go. Don't hop on the bus, Gus. Stay away from the pack, Jack. Sneeze into your sleeve, Steve, to keep virus free. Stop touching your face, Grace. Stay back to 6 feet, Pete. Keep washing your hands, Stan, and heed CDC. Don't visit your gran, Jan. Wipe down every toy, Roy. Don't hoard all the food, dude. Please buy sensibly. Just use some Perel, Mel. Keep wipes near at hand, man. Don't listen to John, Don. You don't need more TP. This isn't spring break, Jake. Stay home if you're sick, Dick. Just follow the rules, fools, and stay virus free. Thank you.
Wow, that was 50. Natalie, you probably don't even know that song.
I do.
Do you really? Oh my, oh, look at you got clapping. Yay, that was awesome.
Yeah.
Guys, let me tell you about next week. We have Dr. Murdy, and he is from Baylor Scott and White. And so he's changing up his title. Originally, his title was something along the lines of the number one thing you need to do to stay healthy. Well, we know that's changed now. So he's going to be talking somewhat in some way or form or fashion about the coronavirus. So we look forward to that. We're going to sign off now. And my name is Cindy Cummings. I am one of the founders of the LT Senior Services, and we are so happy to have had you all here today. And we'll see you next week. Bye, everyone.
Thank you, Cindy.
Bye.
A sneeze. There we go.
God bless you. Bye, everyone.
Bye-bye.